Hello everyone, hope you all are doing very fine. Myself Amit Kumar Mani, founder Global Pharma Academy. Today we are going to discuss about the medical coding. Medical coding free course, this is the second part. Basically we already done a first part a long back. If you would still not saw this video, just click over the I button. We already provided there all information related to the basic information like what is medical coding, what is revenue cycle management, what are the different conventions, what are the different terminologies in the medical coding and guidelines. Okay, so that was the first part, and on the request we are creating here the second part. So if you want to build the career in the medical coding, or if you want to learn, so definitely this video will be more beneficial for you. And also if you are preparing for CPC exam, certified professional coder exam, you can join our 3 months training program in the medical coding. The link or the Google form given in the description, just fill that Google form. We will share all the details to you. So let's get started. This video is all about, first I will tell you what do you mean by ICD-10-CM, what are the benefits of ICD-10-CM, different terminology related to this, then different indexes in the ICD-10-CM, and how to find the code in ICD-10-CM live. I am going to tell you. So let's get started. First of all, I will tell you what do you mean by medical coding. Medical coding is nothing but it is a universally accepted alphanumerical code which is generated by diagnosis, by procedure, by surgery, or any medical condition. So while patient admitted or patient visited to the doctor, okay, and doctor diagnoses them, or if any surgery preferred, then whatever the procedure like conducted on the patient, that all the documentation should be submitted to the insurance companies, and in that insurance company will pay the amount to the clinics or hospital. And this whole procedure is called as revenue cycle management. Here medical coding is involved, then next is AR calling is also involved, medical billing is also involved. So today we are going to discuss about the ICD-10-CM. So what is ICD-10-CM? It is the one of the dictionary used in the medical coding. There are 3 dictionaries used in the medical coding. First is ICD, International Classification of Disease. This is completely based on the diagnosis. So whatever the diagnosis codes are there, it involved in the ICD. Next one is the CPT, Common Procedure Terminologies. It involves all the surgeries and like procedures it involved in the medical coding in CPT. And the next one, HCPCS, Healthcare Common Procedure Coding System. It is actually the suggestion given by the doctor for using a surgical equipment or medical devices to the patient, like walker or stick. So this is under the HCPCS code. Now we are going to discuss about the ICD-10-CM. ICD-10-CM is invented by the World Health Organization, okay, and it is maintained by AHIMA. Then it is maintained by different organizations. Let us see which organizations are there. First one is CMS. It is means Center for Medicare Services. Then NCHS, National Center for Healthcare Statistics. Then AHIMA, American Health Insurance Management Services. Then AHA, American Hospital Organization. Now we discuss about the benefit of ICH. The first one, facilitate payment to the healthcare services. Like let us say if doctor do the diagnosis or procedure on the patient, they submitted all the clinical report to the insurance company and they paid to them. So this is all because of the coding. Because if the patient do diagnosis only, it is outpatient. If the patient is admitted to the hospital, then it is inpatient. Then study healthcare cost. This is again the benefit. So like here there are E&M codes are assigned. So it is depend on the patient. If the patient is new, like in the lifetime he first visited to the clinic, he is a new, or even since last 3 years he is not visited to the any doctor, then also it is new. But if he is frequently visited to the doctor in once in a year or 6 months or 3 months or monthly, so that will be the existed patient. So the E&M codes for those are, so like 99211 to 99215 is for the established patient, and 99202 to 99205 is for the new patient. So there are 2 types of indexes are there for the ICD. First indexes is the alphabetical, second one is the tabular. So already as you know that there are the medical dictionary, and how you can find any word in the medical dictionary. So you are checking the first word like alphabet A or B or C, whatever, and accordingly you search to the medical dictionary. Same way Here also you can check the medical the medical code. Okay, so that is called as alphanumerical indexes. So it includes different types. Like first one is table of drugs and chemical, then external cause of injuries, then table of neoplasm, it include cancer related, then indexes of disease and injury. Then the next one is tabular indexes. It include main term, subterm and crossover lines. So it specifies like major disease is main, then in which part it causes and in which part of this part, like in the specific code. That is all about the crossover lines. So these are the two indexes we are using here in the ICD. Now we will understand the different terminologies. The first terminology is NEC, not elsewhere classified. It is used when there is no medical code existed for that particular disease. Next one, NOS, not otherwise specified. It includes that code which is it is not confirmed that whether it is acute or whether it is chronic. Next one is parenthesis. What do you mean by parenthesis? So whenever any medical condition is given and in the bracket there is some similar condition are mentioned, like abdominal pain or floating abdominal pain, chest pain, okay, then atypical chest pain. So both are same. It is called a parenthesis. Next one is a colon. What do you mean by colon? So as you know, in the grammar there is a colon, right? So here whenever there is specific medical condition is there, but any other conditions, like let us say abdominal pain is there, in abdominal pain with like floating abdominal pain or abdominal pain with vomiting, okay, so likewise the next code will be different, okay, but the previous code is the same. That is called as colon. Then the next one, C and C more. Like if you are checking any code, like next is we are checking live codes. So here the C option is there. C means check other like medical codes. Then C more means check any other specific medical code. So basically it will help to exactly assign the accurate medical code for any specific condition or diagnosis. And the next one, include. Include means all the codes, related codes are assigned here. Exclude. In exclude there are two exclude. Exclude 1, exclude 2. So like if there is any specific medical condition and two codes are like similar to that, only one code can be considered in exclude 1. In exclude 2, two codes can be considered. Okay, so this is all about different terminologies. And one more thing is default code. Default code is nothing but whatever the medical conditions are there, like let us say there is a fracture, and so fracture comes with the pain, so pain is already there is a default code. Okay, so likewise this is the codes and this is are the different terminologies. Now we will discuss all about the how to exactly search the codes on the ICD website. So now you can check icd10data.com. Exactly icd10data.com you can check and you will find different like pages. Okay, so let us discuss about this. Click here, codes, indexes, conversion, DRG, rules, analytics, then changes, HCPCS, then licenses, data files and disclaimer is included. Then we can click on the indexes. It includes ICD-10-CM index, ICD-10-CM external cause index, table of drugs, table of neoplasm. Codes we can check about the chest pain. So you have to like search the chest pain, ICD for chest pain. Then we will come to know here there are different codes like chest pain, unspecified, other chest pain, ICD-10-CM for diagnosis code, ICD-10-CM for diagnosis code. Like there are R07.9, 07.89. So in case of the unspecified chest code, that is R07.9. In case of other chest pain code, in case of other chest pain like atypical discomfort, then exertion, then localized chest pain, non-cardiac chest pain, and there like musculoskeletal chest pain, non-cardiac chest pain, pain of sternum, all kind of the pains will be included in R07.89. So that likewise you have to exactly check the codes which is related to the condition. Here you can check there are green and red arrow. Green arrow it means it is a complete code. Red arrow it means it is incomplete code. So in case of the red arrow you can check on the notepad, click on the notepad, it shows again the exactly like the targeted code, so that you can complete the code. So let us see how it will be there. Here the code is R07, right? It is incomplete as it is red. Now you can check the pain. It is a code for pain in throat and chest, but exactly pain in throat and chest, that is R07, but in pain in throat R07.0, pain in chest, pain on like breathing, that is 07.1, 07.2 it is for precordial pain, 07.8 it is for other chest pain, 07.81 it is for pleurodynia, 07.82 it is for intercostal pain, 07.89 it is for other chest pain, then 07.9 chest pain unspecified. So likewise you can exactly check the targeted code which you are looking for. Now we check the abdominal pain. So abdominal pain includes that kind of if you check, there are ICD-10 same diagnosis code R10.9. Okay, it is for unspecified code, then unspecified abdominal pain code, then for upper abdominal pain R10.10. Okay, for the lower R10.30. Okay. As I said earlier, there are like exclude 1, exclude 2 are the criteria. So exclude 1 includes only one code you can consider. In exclude 2 codes you can consider. So here the we can check the joint pain. Okay, if we consider the joint pain, here the codes are 0 ICD-10 same diagnosis code M25.5. it is pain in joint. So it exclude 2 include pain in hand, pain in finger, pain in foot, pain in limb, pain in toes. Okay, likewise there are different codes assigned here. Now we can check for the asthma also. So here you can check in the asthma, there are different codes. J45, there are a lot of codes, means there are different specifications, like minor asthma is different, then wood asthma with chronic obstructive pulmonary disease, chronic asthmatic obstructive bronchitis. So there are different codes inside one code. Okay, so likewise you can check the all codes, like here you can check ICD-10 CM diagnosis code J45. So here if you consider all the specific condition, asthma is J45, but for mild intermittent asthma J45.2, uncomplicated asthma J45.20, J45.21 is for mild intermittent asthma with the acute exacerbation, then mild intermittent asthma with status asthmatic conditions, it is J45.22, J45.3 is means mild persistent asthma, and likewise many codes you can check here. So I hope you understood how you can check the code according to the specific condition on ICD. Okay, so this is how you can check, and actually in the industry also you need to check likewise. Okay, so medical coding is really good career opportunity. If you want to build the career, you need to learn all the terminologies, all things. Okay, so this channel will help you to know more about the medical coding. But if you want to prepare for the CPC medical coding, just you to join our 3 months training program in CPC medical coding. For that reason, you can fill the Google form given in the description, or call to this number, or visit our website. Thank you for watching this video. We wish you all the best. Keep in touch with us. Okay, and if you like the content, don't forget to like this video, don't forget to subscribe our channel, and don't forget to share this video to your friends and colleagues, and even whoever needed it, so that they can learn the medical coding. Thank you for watching this video. Bye bye.